Just what is chronic lymphocytic leukemia? Cancer starts when cellular material in the body begin to grow unmanageable. Cells in nearly any area of the body can become cancer, and will spread to other areas of the body. For more information on how cancers start and also spread, see what is cancer? Chronic lymphocytic leukemia, CLL, is a type of tumor that starts from cells that will become certain white blood cells, called lymphocytes, in the bone fragments marrow. The cancer, leukemia, cells start in the bone fragments marrow but then go into the blood. In CLL, the leukemia cells often build up little by little over time, and many people have zero symptoms for at least a few years. In time, the cells can propagate to other parts of the body, including the lymph nodes, liver, and somber. What is leukemia? Leukemia is actually a cancer that starts in the blood-forming cells of the bone marrow. When one of these cells adjustments and becomes a leukemia mobile, it no longer matures typically. Often, it divides for making new cells faster as compared to normal. Leukemia cells furthermore don't die when they must. This allows them to build up inside the bone marrow, crowding out their normal cells. At some point, leukemia cells leave the bone fragments marrow and spill to the bloodstream, often causing the quantity of white blood cells in the blood to increase. Once in the blood, leukemia cells can propagate to other organs, where they could prevent other cells within the body from functioning normally. Leukemia is different from other types of tumor that start in organs just like the lungs, colon, or breast area and then spread to the bone fragments marrow. Cancers that commence elsewhere and then spread for the bone marrow are not leukemia. Not all leukemias are the same. Understanding the specific type of leukemia aids doctors better predict each and every patient's prognosis, outlook, and select the best treatment. What is a long-term leukemia? Whether leukemia will be acute or chronic will depend on whether most of the abnormal cellular material are immature, and will be more like stem cells, or perhaps mature, and are like standard white blood cells. In chronic leukemia, the cells can easily mature partly but not entirely. These cells may seem fairly normal, but they are certainly not. They generally do not fight illness as well as normal white blood cells do. The leukemia cellular material survive longer than standard cells, and build up, crowding out normal cells inside the bone marrow. Chronic leukemias can take a long time before they result in problems, and most people can easily live for many years. But long-term leukemias are generally harder to cure than acute leukemias. What exactly is lymphocytic leukemia? Whether leukemia is myeloid or lymphocytic depends on which bone marrow cells the cancer starts off in. Lymphocytic leukemias, also known as lymphoid or lymphoblastic leukemia, start in the cells that will become lymphocytes. Lymphomas may also be cancers that start in these cells. The main difference between lymphocytic leukemias and lymphomas is the fact in leukemia, the tumor cell is mainly in the bone fragments marrow and blood, whilst in lymphoma it tends to be inside lymph nodes and other tissue. Are there different types of CLL? Medical doctors have found that there seem to be a couple of different kinds of CLL. One sort of CLL grows very little by little and so it may take a long time before the sufferer needs treatment. The other sort of CLL grows faster and is also a more serious disease. The particular leukemia cells from these kinds of two types look likewise, but lab tests can tell the between them. The tests try to find proteins called ZAP70 and also CD38. If the CLL cells contain low numbers of these proteins, the leukemia tends to grow more slowly. Which are the other types of leukemia? There are several main types of leukemia according to whether they are acute or perhaps chronic, and myeloid or perhaps lymphocytic. Acute myeloid, or myelogenous, leukemia, AML. Long-term myeloid, or myelogenous, leukemia, CML. Acute lymphocytic, or lymphoblastic, leukemia, ALL. Long-term lymphocytic leukemia, CLL. In acute leukemias, the bone fragments marrow cells cannot fully develop properly. Immature leukemia cellular material continue to reproduce and build way up. Without treatment, most people with serious leukemia would live only some months. Some types of serious leukemia respond well to be able to treatment, and many patients may be cured. Other types of acute leukemia have a less favorable perspective. Myeloid leukemias, also called myelocytic, myelogenous, or non-lymphocytic leukemias, Start in early kinds of myeloid cells, whitened blood cells, other than lymphocytes, red blood cells, or platelet-making cells, megakaryocytes. Rarer kinds of lymphocytic leukemia. The common kind of CLL starts in C lymphocytes, but there are some unusual types of leukemia that reveal some features with CLL. Prolymphocytic leukemia, PLL. In this type of leukemia, the tumor cells are similar to normal cellular material called prolymphocytes, premature forms of B lymphocytes, BPLL, or T lymphocytes, TPLL. Both BPLL and TPLL tend to be more aggressive than the usual form of CLL. Most people will respond to some kind of treatment, but over time they have a tendency to relapse. PLL may possibly develop in someone who previously has CLL, in which usually case it tends to be a lot more aggressive, but it can also stem from people who have never had CLL. Large granular lymphocyte, LGL, leukemia. This is another unusual form of chronic leukemia. The particular cancer cells are huge and have features of either capital T lymphocytes or another type of lymphocyte called natural killer, NK, cells. Most LGL leukemias are slow-growing, but a tiny number are more aggressive. Medications that suppress the immune system could be helpful, but aggressive situations are very hard to treat. Bushy cell leukemia, HCL. This is certainly another cancer of lymphocytes that tends to progress little by little. It accounts for about 2% of all leukemias. The tumor cells are a type of C lymphocyte but are different from these seen in CLL. There are also crucial differences in symptoms and remedy. This type of leukemia gets its name from the way the cells seem under the microscope. They may have fine projections on their area that make them look hairy. Treatment for HCL can be very effective and is referred to in how is long-term lymphocytic leukemia treated. The rest of this document focuses generally on CLL in adults. Do some simple limited information on hairy mobile leukemia. For information on other sorts of leukemia in adults and youngsters, please see our distinct document. So.